I'm really looking forward to today's conversation with the amazing Dr. David Singh.
Function, well, take that equation, turn it around, then deformity follows dysfunction. A malocclusion is a solution for a complex adaptive system to remain in homeostasis. The malocclusion is saying, this is the best I can give you in the conditions that I'm working in. The teeth are trying to erupt. That's the developmental process. But at the same time, when the genes are interacting with the environment and you get a slightly different solution, also known as a malocclusion. A bit like building a house, you lay a foundation, put up some walls, put up a roof, and the last thing you do is the interior design.
Yep.
And so that is where the teeth can be positioned into the space that's available. What is the compensation this child is walking in with, developmental compensation and postural, that I have to untangle for those teeth to be sitting in equilibrium by the time I'm done. Our child rearing practices from the get-go have changed fundamentally. What we feed our kids, how we feed our kids, when we feed our kids. We need a hard diet. There's a very strong relationship between tooth development and brain development. The cranial base sets the pace for the rest of the face.
How do you explain the role that breathing has on the craniofacial growth and development?
Well, that is absolutely critical. So remember this, that babies are obligate nasal breathers. They just want to breathe through their nose. My opinion is that the research sometimes follows the clinical experience, and sometimes it's the other way around. I've seen it many, many times where you think, the AHI says this on the sleep study, but actually I'm going to do this instead.
Yeah.
If the palate is not broad and flat because the tongue is not molding it, now you change mode into an oral breather, mouth breather, it makes a bad situation worse. Do they have a nasal airway? Do they have tonsils? Do they have a low tongue posture? Are they a mouth breather? Do they have an everted lower lip? So on and so forth, which we see every day, we recognize every day.
Yep.
We drive right past, right?
Yes.
So if the tongue is sitting on the roof of the mouth, those lips will come together very gently. The teeth will be in occlusion, and guess what? The guy's going to be breathing through the nose.
Yep.
That's pure physics. It's just pure physics. But I think for the next generation of orthodontics, we have to think about integrating orthodontics into human health.
Love it.
Patient walking in, I am not treating your teeth today. I'm treating you as a patient who has an orthodontic issue that needs to be resolved for the overall well-being of this individual. That's what it's about.